Hi team, Melissa from Melissa vs Fibromyalgia here, and we are chatting low-dose naltrexone for fibromyalgia and chronic fatigue. So I've got a full training for you, which I'll leave the link below, so if you've got quite a lot of questions you need answered, that will help. Today we are going to focus on pregnancy. First, a little summary. Low-dose naltrexone is an opioid antagonist when you take it at a higher dose, but when you take it at a lower dose, it seems to block the opioid receptors temporarily, which encourages our body to make more endorphins, which seems to help us with pain relief and many other things. So I wanted to talk about pregnancy. Now, when you're talking about medicine and pregnancy, it's always a cost versus benefit analysis. And there are very rarely research studies because it would be unethical to give medicine that could potentially harm a baby, right? That would just not work. So it's about experience of people who have gone before and what the medical professionals say. So there is a medical professional called Dr. Phil Boyle. He's a fertility doctor, and he found that using LDN helped keep his autoimmune patients who had previously miscarried, help keep them pregnant and carry their baby to term. So there are fertility doctors using it to help women stay pregnant. And he's got some resources, and I'll put a link below to a talk that he did about low-dose naltrexone, pregnancy and breastfeeding, but he considers it safe at the doses we talk about for low-dose naltrexone. I personally took low-dose naltrexone during my 3rd and 4th pregnancies, and even with severe pelvis issues, I'm talking symphysis pubis disorder and sacroiliac joint dysfunction, so two very serious things which impacted my mobility greatly. Even with those, they were much better pregnancies. I was far more well, and it was a more positive experience, and I was able to nurse for as long as I wanted to. So my first two, the nursing just didn't work out. I was too exhausted and in too much pain, and with these ones I managed. The first one I got to 13 months. When I decided to wean, I was exhausted and needed to start sleeping, and with my 4th I got even beyond that, was still going. So for me personally, it has helped me so much, and that's part of that cost versus benefit relation analysis, right? So for me, the benefit is phenomenal, which must lead on to the baby, right? If I am a good environment for the baby will grow nice and strong. But there are resources around. It is ultimately between you and your doctor, but I encourage you to look at the research yourself, so that you can have an informed chat with your doctor, because some doctors just don't know. This is not their area of specialty, and if they don't know, then they might not feel comfortable. But if you can come to them and say, here's the information and here's how I feel, then maybe the discussion will go differently. So yeah, let me know. Have you taken LDN while pregnant or breastfeeding? Has it helped you to stay pregnant? Does it help you to have an improved experience? Let me know if you have any other questions, and I hope you have a great day.